Life moves fast, and so should the answers to your biggest questions. Welcome to Endo Batteries Quick Connect, your direct line to expert insights. Short, powerful, and right to the point. You send in the questions, I bring in the experts, and in just 5 minutes, you get the knowledge you need. No long episodes, no extra time needed. And just remember, expert opinions shared here are for general information and not for personalized medical advice. Always consult your provider for your case-specific guidance. Got a question? Send it in, and let's quickly get you the answers. I'm your host, Alana, and it's time to connect. I'm joined by my guest, Dr. Zachary Spiritsos, a board-certified neurogastroenterologist with a passion for treating irritable bowel syndrome, functional abdominal pain, and mobility disorders. With a strong background in teaching, research, and patient-centered care, he brings a wealth of knowledge and compassion to the table. Please help me in welcoming Dr. Zach Spiritsos. Talk to us a little bit about what you see in symptoms with your hypermobile EDS people and your POTS people and the MCAS people. What are the things that you see most in those patients? Because I bet you if we could sit down and identify, okay, these are some of our symptoms too, here's maybe some ways we can address that. What do you typically see in those 3 subsets of patients?
Yeah, so they land in my lap. So I'm a neurogastroenterologist. So I stole this from this amazingly smart doctor, Dr. Brandler, who's a neurogastroenterologist up in Seattle. And we are electricians, not plumbers. Okay. Mm-hmm. And so when patients come to me, they have GI symptoms, but then they start talking about other things that don't necessarily fit into IBS. So initially, when I first graduated and I was in practice, I took on a lot of IBS patients. I just happened to love taking care of that patient population. Mm-hmm. But then someone would say, you know, I have IBS, but all of a sudden, when I get up, my heart just races. I'm like, that's not IBS. I think an antiquated view of that is like, oh, you're stressed, and stress causes anxiety, and stress causes palpitations. But this is different. So in POTS, the hallmark feature is standing up and just feeling like your heart is racing. Okay. Mm-hmm. And with that, I would say that brain fog is a really big symptom there. Mm-hmm. And then kind of secondarily, some people get a lot of blood pooling in their feet, like their feet get swollen. But yeah, certainly the standing tachycardia or the heart racing from going to sitting to a standing position is the hallmark features of postural orthostatic tachycardia syndrome. But they also may have a lot of GI symptoms, getting full early, tons of bloating, loose stools, conversely constipation. So the POTS GI system doesn't really follow any specific rule book, unfortunately.
Yeah.
Okay, so mast cell activation syndrome and of course this can be linked with POTS too. So when I'm talking to one of these patients, I'm asking all these questions. I'm screening for every one of these things to see if we can kind of piece this together. But the hallmark feature of mast cell activation syndrome is probably skin manifestations. So itching, rashes, secondarily kind of ears, nose, and throat issues, rhinorrhea, like eyes watering for like no good reason. And then GI symptoms are kind of probably come in third there. And that's bloating, diarrhea, lots of heartburn, and someone who like shouldn't get heartburn. Heartburn traditionally affects people who are, a little bit older, have their BMIs are probably closer to 30. Like we see these young women who are 22, 23 with rip-roaring heartburn. I'm like, that ain't GERD. It just doesn't make any sense. And that's MCAS. So that's where, so just like without getting too into the nitty gritty of the pathophysiology of MCAS, but these mast cells are just very twitchy, right? They're intended to be selectively defensive against certain pathogens that our body doesn't like mold. If anybody's in North Carolina like me, just the pollen is insane. So mast cells are supposed to be acting up now. But these mast cells become twitchy and react to virtually everything from temperature changes to emotional changes to poor sleep to medications. It's really wild. And one of the chemicals that it releases, and it releases hundreds of chemicals, is histamine. Yes. And histamine plays a big role in creating acid secretion from the stomach, which could lead to heartburn symptoms. But for all intents and purposes, patients don't behave like traditional gastroesophageal reflux patients. They don't respond to proton pump inhibitors. and they have no darn reason to have reflux to begin with, right? They don't have a big hiatal hernia, which is a traditional risk factor for reflux, or they're not overweight. And so that's where you have to start, this doesn't quite make sense.
Right.
Okay. Then you said EDS.
EDS, this is a big one for us, okay? I have a lot of questions for this one.
Okay, so again, I'm a GI doctor, so I deal with a lot of the GI manifestations.
Right.
But I certainly screen for all of, all my patients who have MCAS, who have POTS for EDS specific symptoms. And the Beighton score is really nice. Testing certain joint mobile hyperflexibility, being able to, put both palms on the floor with extended knees, are you able to bend your pinky back beyond a certain angle? You'll be able to bend your thumb beyond a certain angle. And you can look up the Beighton score and kind of assess for yourself. But, did you have kind of weird random joint subluxations as a kid? Did your knee just pop out of joint? Like, that's not supposed to happen. Right. And they're like, oh yeah, we put a brace on it and kind of said that was fine. I was like, that's not fine. Like, that doesn't happen. So you have to always ask why. Right, exactly. Like if you're Shaun White and doing, kick flips on the half pipe, fine. Like that's reasonable. But just like, I was playing kickball and my knee just popped out of place. Like, that's not a thing.
Right.
So in a nutshell, like a very condensed, oversimplified way of kind of, I think, compartmentalizing those conditions. So it's really important, to really do a thorough review of systems and ask all the questions so you can really understand why something happened.
That's a wrap for this Quick Connect. I hope today's insights helped you move forward with more clarity and confidence. Do you have more questions? Keep them coming. Send them in, and I'll bring you the expert answers. You can send them in by using the link in the top of the description of this podcast episode, or by emailing contact@endobattery.com or visiting the endobattery.com contact page. Until next time, keep feeling empowered through knowledge.